Good morning, everyone. Actually, it's almost lunchtime. Thank you so much for coming to our joint webinar by KPU and SFU to address food concerns, food access, and mobility during COVID-19. We are going to be starting very shortly, so please welcome. We're just waiting for a few more people. In the meanwhile, because it is lunchtime, feel free to have your food and your coffee and your tea and make yourself at home. Okay, I believe we are officially live on the webinar. Thank you so much for coming. This is a joint webinar by the Institute for Sustainable Food Systems at KPU, as well as a webinar by the Food Systems Lab at Simon Fraser University. We are so grateful that you've taken your busy time today in the midst of all of the snow and everything to come and join us in this webinar to address food concerns, food access, and mobility. Again, so thank you so much. And let's go to the land acknowledgement. And so when I speak of the land acknowledgement, I want to first acknowledge that I am calling in from the unceded ancestral and traditional territories of the Coast Salish peoples, the Musqueam, the Squamish, and the Tsleil-Waututh First Nations. And at KPU, our colleague, KPU is on the unceded lands and territories of the Kwantlen, the Musqueam, the Tsawwassen, the Katsi, the Semiahmoo, the Kaikat, and the Coquitlam First Nations. Well, would you mind clicking next to the land acknowledgement? Thank you so much. And so when we say our land acknowledgement, I just want to mention that we do so to breathe life into our responsibility and our commitment to the land. We hope that this webinar can contribute somewhat to this efforts, particularly to promote Indigenous food sovereignty. So this research cannot be done without the generous contributions and the support, whether it be in kind or financial, from our sponsors and research partners. Today, we would not be here without the support of the BC Poverty Reduction Coalition, who is our research partner, and Viveka Ellis will be here today to speak a little bit about the organization. We also have Krista Lowen from Van City. Van City has been such a generous sponsor of the KPU study, and Walapak can talk a little bit more about that later. And the SFU Community Engaged Research Initiative has been so kind and generous to contribute funds, not only to support my research assistant, but Daniel Rajasurier, and as well as the study itself. And of course, Nature's Path. Nature's Path has also provided contribution to student stipend and honorarium. So again, thank you so much to our sponsors. We would like to invite Krista Lowen from Van City to come into the virtual platform and maybe share a few words or so about their generous contribution. Krista, please feel free to join us.
Hi, everyone. Thanks so much. So my name is Krista, and I'm an associate in the Community Investment Department at Van City. So Van City is Canada's largest community credit union, and we're committed to improving the well-being of our members, but we're also committed to building a clean and fair world that ensures that nobody gets left behind. So at Van City, we know that resilient and sustainable food systems are really vital to meeting the basic needs of our members and their communities. And we see equitable access to food really at the intersection of both climate justice and social justice. And we use at Van City a share of our profits. We call shared success. We invest 30% of our profits back into the local community. So we do this to support the advancement of sustainable food systems that really will benefit all people in our communities. And so we were really grateful to be asked to support this initiative because we know how important it would be to really understand the problem of equitable food access in our communities. That way we can work together with our partners to solve and create joint solutions for these problems. And so I just want to thank Walapak and her research team, and I just want to thank also all of the other sponsors and everyone that's had a hand in contributing to this research, and look forward to their presentation today. Thank you.
Thank you so much, Krista, and thank you again, Penn City, for funding this research, especially the research from KPU on food. And I hope that this research will make a splash and an important contribution. And so next, I would like to invite to the virtual platform Viveka Ellis from the BC Poverty Reduction Coalition. The BC Poverty Reduction Coalition is a research partner in this project with SFU Food Systems Lab. So Viveka, the floor is yours.
Thank you very much, Tamara. First of all, I would like to say thank you very much for the opportunity to be here today and for this wonderful collaboration. Thank you yourself, Tamara, for all the work we've done together. Daniel, your graduate student. I'd really like to thank the City of Vancouver, which is the core funder of Getting Around to Feed Ourselves Well, and for their flexibility around the pandemic and pushing the project forward. Van City and the Van City Community Foundation for their financial support for the Poverty Reduction Coalition and this project. And of course, the SFU Community Engaged Research Initiative, which has enabled the BC Poverty Reduction Coalition to join Tamara and SFU for this project. So the BC Poverty Reduction Coalition is a coalition of around 110 partners and members throughout British Columbia, including community-based groups, large charities, labor unions, and others. And we come together to advocate for public policy solutions to poverty in this province. At this time, we have what we call our Blueprint for Justice, which has 70 public policy recommendations to government at this time. And I suppose what I'd like to note about this initiative and how exciting it is one of the campaigns we've had going the past 3 years has been the All on Board campaign for affordable and accessible transit. And we uncovered the need for this campaign based on our very embedded and engaged work with community and those most impacted by poverty through our Community Action Network initiative. And one of the things that we've been hearing about for many years is how challenging it is for people to access food security based on what we call mobility poverty. So that gave rise to the applications and the appealing to funders for support to really take a look, particularly within the City of Vancouver, on the impact of mobility poverty, access to transit and transportation, and access to food security in the city. There's one other quick point I'd like to make, that when we released our poverty reduction strategy, Together BC, in 2018, food security was cited as one of the areas that our government was not going to get to in 2018. So it is exciting that food security in the new mandate letters is explicitly stated in the Ministry of Agricultural mandate letter, the Ministry of Social Development and Poverty Reduction mandates letter, and also the Ministry of Education's mandate letter around more funding for healthy, nutritious school lunches. So just to sign off on a note that this is a very exciting time to make progress in British Columbia, and I'm really excited about how this important research project is going to provide a lot of fuel for the fire to make progress.
Thank you so much, Viveka, and I'm very grateful for the partnership. So that is great. Now, before we go to my wonderful colleague, Dr. Walpak Palasup, I'm just going to be doing some Zoom keeping, aka housekeeping. So first of all, just to let you know that this is a webinar. We will actually be uploading the video itself live after a few weeks, and it will be live on our website, foodsystemslab.ca, and also KPU. Also, a few things is that we will have a question and answer session. And so that will be, there's a tab actually in the question and answer. And so you will be able to use that. Just because of the sheer size of the number, we're not able to use the chat back and forth because that might be a bit distracting. So just to let you know, we can chat with you, but you can't really return back. So do use the Q&A when it comes to question and answer time. That will come at the very end. And so we definitely look forward to that engagement with you. So without further ado, I would like to introduce Dr. Walpak Palasup. She is coming in from the Kwantlen Polytechnic University Institute for Sustainable Food System. Her team there with also Dr. Kent Mullenix has been doing a lot of amazing work on food security, food access, sustainable agriculture. So yes, please feel free to start your presentation, and thank you.
Thank you, Tamara. I think we have a quick question about in the question and answer, just saying that if you want to see who's speaking, so I think you have to adjust on your Zoom window, right? To have it to view side by side, so you can
That's
see who's
right.
speaking.
That's right. If you go on your view, if you don't see the speaker, on the very top right corner, you should be able to click this view button, and then there will be several options. So please feel free to choose which one is best for you. So if you go side by side speaker, that will be the best option, because then you can see the actual person who's giving the talk. So please feel free to do that. Thank you again for the question. And Welpak, you're ready to start?
Yeah.
Okay, go for it.
All right, let's see. Last time the slides didn't advance. So can you see my front page now?
Yes.
Hopefully everyone, yeah, perfect. Thank you. So thank you, Tamara, for the introduction, and also good afternoon again, everyone. So if you haven't heard of us before, the Institute for Sustainable Food Systems is an applied research and extension unit at KPU, and we focus a lot of our work on advancing regional food systems through research, education, community engagement, and all of these to mobilize knowledge into action. And in my presentation today, we'll take a look at what we've learned from our survey conducted last year during the first wave of the pandemic with respect to food access and food system perception. So just going back a little bit, giving you a reminder of what has been going on. So these are our number of daily cases in BC. And last March, when the pandemic first hit us, so that was the BC enter into what we call the phase 1 of the restart plan. So all of the non-essential businesses had to close down, and we remember the news, about food stockpiling and hoarding of toilet papers, and at that time, many things were still uncertain. Rules, regulations, and health recommendations were very, very new to everyone, and nobody knew exactly what to do. And around this time as well, it was right just before the growing season in BC. And so a lot of the producers were very concerned about that situation, about the possibility of capacity reduction due to the closing of the many businesses such as restaurants, because it's all in the same food supply chain, and especially the problem of the shortage of migrant labor as well. And later on in the spring, we see that our infection was down, and we had implemented different measures to protect ourselves. We learned a little bit more of how the disease got transmitted. So we enter into the phase 2. So businesses and schools K1 to 12 reopened again, and things started to look up a little bit. And so around the beginning of the summer, we started going into our phase 3. However, during this time throughout the period, we heard more and more stories about outbreaks in various food sectors, such as on the farms, or in the food processing, meat processing plants, and all these stories I believe that all these stories had made us be more aware of the underlying issues in our food system. And currently, we are in the second wave of the pandemic. It started in the fall, around mid-October, that there have been additional restrictions on social gatherings. However, schools and businesses, certain businesses still remain open, and some are suspended, and schools are open, and I'm very grateful with that. And and this is because most of our outbreaks has been linked to large parties and large gathering rather than at schools or shops. So again, for this presentation, we'll go back in time last year around during the first wave, just to see how the pandemic has impacted people's BC residents' food access. And this project is actually a collaboration with 4 other universities around Canada. As we launched a survey in BC, in Alberta, in Ontario, Quebec, and also the whole Atlantic Canada as well. So we're able to kind of compare the results a little bit across the province. Our BC survey was open from mid-April to mid-August. And we had about 2,200 complete responses, and a lot of these in the lower mainland and in Vancouver Island as well, and a little bit distributed all around BC. And I would say that about because our survey opened for quite several months, almost the whole period of the first wave, but 3/4 of the submission was submitted between the first 2 months of the pandemic. At that time, people are very were at home and wanted to participate in the survey, and then the rest we got it in later in the summer. And we understand that with the online survey like this, it has some limitation. We might not get representatives from all groups of the residents, but hopefully we can still have information that sheds some good some lights on certain issues. So first of all, we ask about the different channels that people access food, and we list a long list of where the places that you could access food, 16, 17 of them, and then we group them together in 6 different groups like this, and we find that overall food the overall participation rates is reduced from 2019 and during the pandemic. The smallest reduction in participation rate is in-person shopping through conventional food supply chain, which is just going to store to shop for food. And the most of the reduction in participation rate is in restaurant dining. And otherwise, the only increase of participation rate that we see is online food shopping. And in this sense, our results are pretty much in line with other survey results conducted around the world as well. And what we find though, because again, our survey was open throughout the spring and in the summer as well, we find that the rate of participation for restaurant dining or through alternative supply chains such as farmer market and CSA subscription, and also growing own food or wild harvesting, these type of food access channel, there are differences between participation rate in the spring and in the summer. So partly understandable because of the weather, we are able to produce our food within our region, most likely in the late spring and in the summer. And with the restaurant dining as well, after when we enter the second phase of the pandemic, restaurants and businesses know more of how to rearrange their restaurants and their business so that we can keep physical distancing possible. So, and then people are able to sit outside as well. So we see that later on, people have a little bit more confidence in going out to restaurants. And next we ask people, how difficult it is so they can, with the ranking from 0 to 10, how difficult it is to access food. And we found that in general, food access in general, people said that it wasn't difficult to buy food in general, but the difficult part is getting the specific food that they want and in the quantity that they want. So that would be the most difficult part. But in general, it was okay, not very difficult to access food. And I think everybody, when they're at home, people have the same mind, they have to get flour, they have to get yeast and things like that. So that's why we see a little bit of a shortage of some food items. However, when we compare the different groups, we find that certain groups of people are more vulnerable more than others in terms of food access. For example, respondents with lower household incomes, when we compare the level of difficulty that they stated that it's difficult for them, we found that they have a little bit more difficult time accessing food than people with higher incomes. And then we also compare indigenous respondent with non-indigenous respondent, and we found that also they have more difficulty in terms of food access, as well as people who are more likely to get severe illness from the infection as well. And then we ask, what are the factors, if you say that your food access was limited, what are the factors that affect you? And so there's a list of factors that affect people, and then people can choose more than one. And then we found that the top 2 factors were personal finances and pandemic anxiety. And other factors would be in terms of physical access, stores are limited, choice are limited, and or transportation. This is going to be perfect when Tamara comes in and talk about her research. And also a new type of access limitation is the quarantine and self-isolation. So this is especially hard if you don't have friends or family members close to you. So, and in terms of other, in the bottom here, other refers to other issues, personal issues that people have. For example, if they have health issues that they cannot wait in line for a long time, or some people say that, you know, they don't want to take children to the stores because it's hard to keep them physical distance, for example. And next, we discussed problem of food access concern in different time frame. So we asked people whether they agree with the statement, at times I don't have access to enough food for an active, healthy life for all household members. And we asked them to compare, to think about in 2019, this month during the pandemic, and next month if the pandemic continues. And then people can choose whether this situation is never true, occasionally true, usually true, or always true. And we found that respondents expressed an increasing level of concern about not being able to access enough food, especially in the future. So you can see that, you know, the level of concern in the next month, if the pandemic continues, slowly increase. And we found that this is especially true again for respondents who are more vulnerable than others. So for example, people who are unemployed at the time of the pandemic, this number is much higher for than people who are currently employed. And also the level of concern is higher also for respondents who have at least one child living in the household. And otherwise, we also asked to cover, you know, in the general behavior, shopping behavior and consumption patterns as well. And people had to adjust their behavior fairly quickly during the pandemic, and the results are pretty similar to other surveys as well. You know, people shop less frequently and they try to buy more of a shelf-stable food. And in terms of behavior changes, they cook more at home. So in that sense, it's pretty similar from other surveys that you've seen. We also found another thing that is similar is that people reported a change in a little bit of how the pattern of consumption. So we found two very contrasting behavior. One group said they eat more snacks, sweet and salty snack, which is a proxy for unhealthy diet. And another group said that they're eating more fruit and vegetable, which is a proxy for a healthy diet. And this is not surprising, actually. Other studies also find the same thing, which is the bottom line. And the bottom line is that people have to change the way they behave, and even the way they think about the relationship and the food system as well. However, in terms of the diet change, we did ask further than other survey. We did ask them to explain a little bit of why they thought that their consumption pattern changed. And this is an open-ended question, so we had to categorize their answers and coded them, and we found that these are the top 5 reasons that have been cited. And we find that more time at home actually affect people differently, because some people are more fortunate than others, and they say that, you know, oh, because I have more time at home now, I'm able to really think about what I want to prepare, what I want to cook, and what I want to eat, and trying to be healthy. And another group, same, oh, I have more time at home now, but it's so stressful. You know, I can't deal with this. So time at home, it just affect people very differently. And our research hasn't gone into this yet in detail, but I suspect that, you know, with the income gap could be one of the main drivers as well, that if you are a little bit richer, then you're less likely to have so much worry about what to do in terms of food access. So now we ask question about perception about food system. So we asked, you know, on a scale of 0 to 10, how concerned respondents were about the reliability of the global supply chain. I'm going to show the results from of all our respondents over across Canada. So in general, all the 5 Canadian regions that we survey, people are relatively concerned, but from province to province, it's a little bit different. For example, Quebec is a little bit less concerned, and then Alberta is here, Ontario and BC around at the same level, and then Atlantic Canada a little bit more concerned than the rest of us. So, and I think right now I would like to have a poll going on for us. So you should be able to see. The question is, do you believe that your local regional food system is substantially developed enough to prepare for future unexpected events such as pandemic or climate change threats? And we're going to leave the poll up for a little bit while I discuss the same questions. So we asked respondents to give us a little bit of their opinions on why they disagree that if we have a substantially more developed regional food system, it would be more reliable. So with the interest of time, I don't want to go over too much. I'm going to emphasize 3 points that respondents say. So the first one is that people really think about food self-reliance, the autonomy of our own region. So people really concerned about, really want to have ability to produce food within our region. And a second one is that in a little bit more of a social capital view is that when push comes to shove, people think that Canadians would support each other. So they really trust in local farmers and believe in local cooperation. And otherwise, in terms of disagreement, people also realize that, you know, there's still a lot of limitation for us to try to make our food system more developed. And I think that's it. So can you see the poll result? So about 67% said that no, our regional food system is not developed enough to prepare for this. And then about 20% said, I'm not sure. And about 15% said, yes. All right, thank you so much for participating. So next, we also, oops, sorry. Next, we asked, again, another open-ended question. We asked, you know, what type of support did people wanted to have? And this is really highlight the niceness of Canadian, because, you know, people around the world usually say Canadians are so nice. And I want to mention this, that a bunch of people write that, oh, I don't really need anything for myself, but I'm very concerned about some other people, you know, who are less fortunate than me. So many people wrote that in. So in general, one of the things that I really want to emphasize, so this is the ranking by the number of times it's been cited. So increased access to locally grown products is the #1 most cited support that they want to have. And then otherwise, the second one is the shopping logistic, you know, want to make it a little bit easier and want to make sure about the safety measures and also financial support. And lastly is the ability to grow or harvest or make their food, make food themselves. So I'm gonna go wrap up now. So with this research, just a few points that I want to make here. First of all, we say that we're in this together, but technically we're not really quite in this together, because inequality in terms of food access do exist, and it has been exacerbated by the pandemic. So we do need fiscal and social interventions, and it has to be targeted to increase ability of food access in vulnerable populations. And there is definitely a connection between mental health, physical health, and food access as well. We see that people are having a lot of anxiety about going out to buy food. So clear communications by healthcare officials and also safe shopping environments should continue to be provided to reduce this type of anxiety. And again, with public health programming as well is needed to address the impact of mental health on diet choices, and also some programs to implement strategy or programs to encourage and maintain healthy eating lifestyle in the population during this difficult time. Also, we need more physical and digital food infrastructure in the community to assist local producer in terms of production, processing, distribution, and retailing, so to bring food to the local consumers. So maybe for example, some online marketing support to small scale local producer to help them stay competitive, or even just actual physical store in the community are also very important, because there's still those who don't have access to the internet or may not be familiar with online system. And finally, food access issue is not just about having the money to buy food or knowing where to buy food, but it's also about food education as well. And it's very important, even simple things like knowing how to cook, knowing how to prepare food, or knowing, how to substitute food. If you wanted to buy something and it's not available, how can you substitute to get the same nutrition contents, for example, or how to preserve food, because in the summer you have a lot of food, but in winter you don't. So how you preserve food to make sure that you have food available in the winter. So that's it for my presentation. I think Hamara would come in now and discuss issues about mobility and food access as well.
Perfect. Thank you so much, Walpak. That was excellent. And so I am going to share my screen.
Here we go. Yeah.
There you go. Okay. All good. Always technology makes me so worried sometimes. Thank you again, Walpak, and the team at KPU's Institute for Sustainable Food System. Again, that was really excellent, and I'm sure that there will be many questions from the audience. So hello again. I see that some of you are just tuning in. My name is Samira Soma, and I will be presenting research that my graduate student, Daniel Rajasuriar, who is in the School of Resource and Environmental Management Planning program, and myself conducted in partnership with the BC Poverty Reduction Coalition. So today will be a very short snippet, a preliminary short snippet, as we only have 15 minutes, but we will be writing a paper soon, and our in-depth findings will be published. So please do tune in at foodsystemslab.ca. Okay, but before we get to the presentation, let's first take a poll before I move on. Since the pandemic, since the pandemic, have you used public transit to access food? And by the way, I don't mean to go out and eat out with friends and, visit a restaurant, but to actually obtain food for daily household needs, like grocery shopping. Yes or no? Okay, I'm gonna wait for a little bit. Okay, it's coming up. Okay, so the no is really growing quickly. Okay, perfect. So right now, what I see, and I'm just going to end poll. Right now, we have 81% of the attendees in this webinar saying that no, they have not used public transit to access food, and 90% of the attendees said yes, they have gone on public transit to access food. So thank you so much for participating in the poll. And by the way, I guess I just shared result. Okay. That's good. And by the way, we will be talking more about transport and mobility soon. Now, household food insecurity is an important issue in Vancouver, with studies after studies. Sorry, this poll is coming up all the time. With studies after studies demonstrating that families are struggling to afford a healthy diet, and that food insecurity is impacting people's health and mental well-being. In a study on household food insecurity in BC, 66.4% of the participants who listed social assistance as their main source of income identified as being food insecure in Vancouver. And the issue of food insecurity disproportionately impacts immigrant and Indigenous communities. So to help alleviate food insecurity in the city, albeit only temporarily, there are many food assets as identified in the Vancouver Coastal Health Food Asset Map. So these include food banks, soup kitchens, free or low-cost grocery items, neighborhood houses, and many more. But of course, to obtain food at these food hubs, one needs to get there. That's why our study is called getting around to feed ourselves well. So it is simply not enough to have the food assets around. It is not simply enough to have the foods available when there are actually multiple barriers that food insecure individuals face in their journey to accessing the food itself. So in our study, we will be focusing on the issue of mobility. And if you're wondering what is mobility, it's basically the ability or capacity to move. So we will focus on mobility and the barriers to food access pre-COVID-19 and during COVID-19. So in this presentation, I will highlight a few preliminary findings based on overarching research question, namely, which individuals and families access nonprofit food hubs? How do individuals and families access food at nonprofit food hubs? Particularly, our focus is in Vancouver before COVID-19 and during COVID-19. And what are some of the challenges and barriers to accessing food at nonprofit food hubs in Vancouver before and during COVID-19? So here is our methodology. Please note that originally we had planned everything to be doing in-person surveys. We were planning to be at the food hubs and at the center himself, but unfortunately that was not permitted by ethics because of COVID-19. So we had to move everything online, especially as we're learning more about the different variants and cases. So there, of course, we recognize that there are major limitations to doing this, particularly when taking into consideration the demographics that we are trying to reach. However, we did our best with the limitations, and we ensured that our survey was compatible with smartphones, that all of the participants completing the survey received a $10 gift card, and we also partner with many of the food hubs as well as the BC Poverty Reduction Coalition to distribute information about the survey. So we did an online survey that was completed by 84 participants. We then conducted follow-up key informant interviews with 10 survey participants because we realized that there was only so much that we could capture in a survey itself. And so the participants in our study had to be over 19 years old, 19-year-old or over, and they have to access a nonprofit food hub in Vancouver, in the city of Vancouver, at least more than once before COVID-19 and during COVID-19. Okay, so first let's go over a few demographic information on who answered our survey. So over 51% of our respondents were between 21 to 30 years old, and over 35% were 31 to 55 years old. Over 55% identified as female, and 38% identified as male. About 70% identified as white, 12% Indigenous, and the rest comprised of diverse racial and ethnic groups in the city of Vancouver. And over 28% of the participants had a gross, so it's not taxed yet, gross total household income of less than $30,000 in the past 12 months. And this also included government assistance programs. So note, this is before taxes in the city of Vancouver. And over 82% said that food obtained from nonprofit food hubs are very or somewhat important part of their household's overall diet. So that's a quite big number who rely on nonprofit food hubs. And those answering our surveys use diverse modes of transportation to access nonprofit food hubs. Survey participants in this study were able to select multiple modes, and they also, the green bar showed before COVID, and then the blue bar showed during COVID. So in general, walking, transit, and cars were the top 3 modes of transportation to access nonprofit food hubs in the city. And I think what's really important is that in general, over 36% of the participants in our survey said that they rarely or never have access to household automobiles. So they must rely on other methods, whether it be walking or rolling. And rolling is the term that people use when they're actually rolling with their walkers. And then also, of course, public transportation. Now, what we found through our survey, so in our study, 25% of the participants actually had a one-way travel time of 45 to 75 minutes or more to access a food hub. So this is just one way, 45 to 75 minutes. So this is a pretty long journey, particularly when you add the return back time. So now we're going to start going into the other findings as per the research question. So what we found through our survey was that there are many barriers to accessing a nonprofit food hub in terms of mobility. Some of these barriers include the long lineup at food hubs, the food hub schedule, transportation accessibility, transportation costs, transportation everything, inconvenience, reliability, you name it. In general, transportation-related barriers created numerous challenges for the participants in our study. And I think here, what the surveys might be missing, the interviews can explain a lot more. So we have created pseudonyms for our interviews, just to let you know. So for Christina, for example, who has accessibility issues and who needs to use the HandyDart TransLink program to go to food hubs, trying to access food can be very inconvenient and time consuming. So Christina noted that when she accessed Food Hub with HandyDart, she always has to be ready within a 30-minute window for pickup both ways, and it often feels like a guessing game. And transportation costs is another major issue. And that's why I was so glad to hear Viveka talk about the importance of transportation affordability. So Carmen, who's a single mom, noted that it costs over $200 a month for transit for her and her 3 kids. And she is low income. And during COVID, she's actually been very, very worried about that cost of transit and trying to access food in her because of her low income as well. And then the inconvenience. So the inconvenience is an issue because many of the community members go on transits and then they carry very, very heavy bags. So Paula, for example, noted, the food bags are very, very heavy. There's 2, but they're heavy in whatever vegetables and other offerings. And so that it's sometimes hard to transport. And it's also a challenge to carry these bags onto the bus or onto the SkyTrain. And then transit reliability, again, this is Christina mentioning that is a major issue, because in the case of HandyDart, Christina noted that one time she actually spent 3 hours waiting. She's waited outside in the freezing rain with her walker. She actually has a walker because they forgot to pick her up. And so instead of just having like a short kind of 1 hour from work to home or from wherever she was, it actually took a full like 3.5 hours to finally get home. So another aspect of mobility has to do with accessibility. So when community members, for example, carry the food into transit, particularly in the beginning, they had to enter from the back and not from the front of the bus. And then in the back, it's harder for the bus to have it lowered. So that creates an accessibility issue. In the case of Carmen, due to all of the inconvenience, she just basically gave up of trying to cart around her food cart in the transit. She tried her best to find organizations that could help deliver food for her and her kids. So another aspect of mobility has to do with so you get on the bus or you walk or you take a car and you finally get to the hub. Now you actually have to get the food, right? So you're not even entering the hub yet. So longer lineups are particularly difficult for members with accessibility and mental health issues. And we found that the pandemic overall has resulted in longer lineup times, due particularly to the need for physical distancing and limits on numbers of community members that can actually enter. So here's an interview, for example, for Lindsay. She actually suffers with anxiety, and the long lineups are very, very difficult for her, and it increases her anxiety and mental health even further, a mental health issue even further. And for Belen, she rushes to ensure she gets to the food hub by 9 a.m. so as to avoid that crazy lineup. And so for those, of us who have the ability to shop at regular grocery store, that kind of long lineup phenomena was very temporary. It was during that big food rush kind of food hoarding phase. But in general, these kind of concerns, these long lineup concerns are not an everyday issue for many of us who actually have access to regular grocery store or supermarket. So do keep in mind that this is something that is an everyday reality for low-income community members. So unlike supermarkets, food hub schedules also are shorter. You don't have 24/7 food hub providing food. You don't have that long, 7-day-a-week kind of hourly schedule. So community members feel a lot of stress trying to make sure that they get there in time to pick up their food, particularly when they're relying on public transit, because especially with, the buses, it can be a little bit slow depending on how many people are coming in. So that kind of stress and anxiety over making it to the food hub in time so that they're not closed has created anxiety for some community members. And so in general, what we found is that 42% of the participants already found it difficult to make ends meet, including with government assistance, way before COVID-19 even started. And during the crisis, this number basically jumped to over 66%. So it was already hard before, it's even harder now. And before COVID-19, 28% of the participants found it very difficult to access food hubs in terms of transportation. So it's challenging, but 28% found it quite difficult. But now during COVID-19, this number has now increased to 41% of the participants in our study who said that it's very difficult to actually access food hubs in terms of transportation. So in general, also, what we're hearing from our participants is that their experience of being in the food hubs have also declined due to the pandemic, with many experiencing closures, longer lineup, less ability to serve at the same capacity, particularly around food programming. So that kind of community environment where they can lounge and maybe sit and talk more comfortably and even benefit from some of the other side programming in addition to the food access, that has definitely declined. And then so that is a further negative impact to the community members. So to conclude, basically financial need does not only inhibit the food access, but it also inhibits mobility. It inhibits, the ability to access the cost for transportation, which then creates further barriers to food access. And I think what's really important at the end of the day is to understand that poverty is a multi-layered experience. And so it's not as simple as just say, well, let's just move the food around, right? It's not as simple as that. So basically what we'd like to do as a team is to call upon systemic solutions that would uplift people from poverty and not just band-aid solutions. So for example, first, transit should be made more affordable for equity deserving communities. And this is where the provincial government has a stronger role to play. Another recommendation is to boost government assistance program, because it's particularly in light of the fact that Vancouver is one of the most expensive places to live in Canada. And so what we have right now is basically not enough. And then also there's a growing call to support for a universal basic income. And I'm sure many of you have heard this, universal basic income, we need UBI, we need UBI. And if one might ask, well, where are we going to find the funds to support a universal basic income? My answer is that we need to get the funds out of tax havens and from the hands of billionaires that are basically profiting through the pandemic. And please note that many multinational food corporations that have headquarters in Canada are also participating in tax havens. And so we need those tax money flowing so we can actually create better support system. And finally, as we hear from many of the participants, we need to explore better delivery options for people that are not necessarily just going to regular grocery markets and can have that online delivery option. Partnership and funding opportunities should be explored between the city, the food hubs, and local community delivery groups. And with that, I conclude my presentation and will actually go and open the question and answer session. And I hope, and this is the bibliography, by the way, and you will have a copy of this video when it's recorded, when we upload it. Maybe not a copy, but you'll be able to watch it. And so thank you again for listening. I hope that was clear and you could listen to everything. And we're gonna go to Q&A. I should be able to see it somewhere, maybe. I think I need to minimize for now. But yes. So let us go to Q&A. I think we already have 3 questions for now. So unfortunately, I have to stop screen share for a second so I can actually see the Q&A. Okay, so I have 3 questions with me. Walpak, do you mind joining me? Yes, perfect, great. So we have an anonymous, oh, well, all of them can be anonymous. So here the question is, and I think, Walpak, this is for you. Do you think that there should be a cap on blueberry growing in BC's Lower Mainland so that we can grow more perishable vegetables? As from your survey, people are wanting more local vegetables, and that in turn can increase our food self-reliance. What do you think about that?
Yeah, thank you. Thank you for the question, for sure. And this is something that it's kind of like, it's a balance, right, between the policy of trying to increase your ability to produce your own food and also increase the money that you get from the exports. And I feel like whether to cap it or not, I mean, some people would think that, well, we don't want a top-down policy that tells us what to do. And I feel like probably the best way to go about it is that gather interest of the people and see that, you can actually grow something else that make money. So people don't have to just concentrate on just growing a few products for export markets. But if we have the local market, that we have people ready to buy local products. Because right now, many people say, oh, definitely buying local products. But then when they often see it and then they complain how, oh, why is it so expensive? Or, oh, it's hard to get. I have to go to farmer's market. I want more convenience of just one-stop shopping, kind of like that. So I think it's a definitely a balance, what policy you wanna go, and I feel like we could do more of supporting locally grower to actually support them to be able to survive essentially. Because right now, why do people not growing more vegetables? Because people say it's such a hard work and they don't make much money. And then why don't they make much money? They don't have markets for it or things like that. And another thing is, I want to mention one more thing about we still have agricultural land that is underutilized. Many people, keep the land there because they feel like, oh, in 20 years, I can sell this and develop and get millions of dollars. So we need to have a policy where the land needs to be for growing food and make sure that it is used for growing food as well.
Thank you so much, Philippa. And I think that is a very good call for a more longer term strategic planning in terms of food resiliency. So it's not just, these, as I mentioned, Band-Aid solutions. Now we have another question from Mary Ann, especially around the focus of food justice organization. And so definitely during COVID, a lot of the focus is about providing direct food sources. So hamper programs, food boxes, and what have you. And I think these are all important, but what happens especially for the community members that we talk to, these food hubs are sources of camaraderie, sources of building relationship, of learning. Their kids go there and do different workshops. And so it's really, really important for their mental health and also their well-being. So because of many of the closures and also the focus on just providing like food hampers or food boxes, that has definitely, carved a big chunk out of what is, very, very important and critical programming for community members. So, obviously, as we're learning more, hopefully we can come up with safe plans to, again, think about how to offer these beneficial programming to community members. So that's a great question. And I think we also have Mariam. How do we ensure everyone has access to food in BC and the Lower Mainland? And I think Wallapak, you've tied into that a little bit about supporting the local food economy and also ensuring that the land is actually used for food growing. We have about 3 minutes. Do you want to add a few things to that question, Wallapak?
No, I just want to emphasize your point, Tamara, about the income as a really focal point too, of food access, because in our survey, we do find that with income inequality, it does affect a lot of the ability of people to access food. So I also support, universal basic income, making sure that at least people don't have to worry about, one less thing to worry about.
Absolutely. And I think, one of the things that I've learned from especially working with many community members is that they say that, in the food hampers, they would like to get a lot more fruits and vegetables, and they would love to get access to BC strawberries and BC blueberries. Who would not want to have access to that? But currently the pricing structure is not made so that BC residents can actually necessarily access BC food. So there is that kind of imbalance that needs to be addressed. And so that, again, these kind of income support program is very, very important, and not just food support program, but also income support program to uplift people from poverty. And I think I'm going to go to one more question, and then we're going to have to wrap up, unfortunately. So, oh my goodness, now we're just getting a lot more. So due to increase in new apartments going up, community gardens are not available as much because the land is being part of development. How can we get developers to leave land aside for community gardens? And so I think this is a very good planning question, and something that I know that the City of Vancouver is doing a lot of work really exploring how to make gardens more accessible. So I would definitely stay in tune. But yes, when land is only valued from the financial, kind of capital aspect from development, and the food aspect is not really considered as the core and as a core value, then it's very easy to just kind of put that aside. And finally, agriculture and colonization are very much intertwined. How can we address indigenous sovereignty and food access sustainability for all? And Welpak, I think you and I will agree that we both are very committed, and our institutions are very much committed to supporting and promoting indigenous food sovereignty. And so this webinar is just one of many. It's kind of like a stepping stone, it's a puzzle piece that we'd like to kind of piece all together. And that's why we'd like to do more joint collaboration, more partnerships. So Olga, I'm sorry I can't get to your question right now, but please do get in touch with us. I am actually going to leave the email for us, so that if you want to get in touch with us, learn more about our research, please do connect. And also we do a lot of collaboration with different municipalities and organizations. So thank you so much. Sorry I'm speaking so fast, but we have very little time. On behalf of all of us, the partners, the sponsors, my graduate student Daniel, we are very, very grateful that you've come today. So I hope you have an awesome lunch, right, Welpak?
Yeah, and also I think I have email address of everyone. So once the webinar is ready, Tamara is going to put on YouTube, and then I will send out the link to the webinar for everyone again.
Perfect. Thanks, everyone. Have a wonderful, wonderful snowy day.
Yeah,
Bye.
thank you so much. Bye.